compare sides. So feel that side too.
Mm-hmm.
You feel how that's much harder under your hand right there.
Mm-hmm.
Okay, so we're gonna keep your hand here. We're gonna take her arm, and when do you feel it get harder under your hand? Probably right there.
Right there, yeah.
So like I can feel that change simply by her arm. That's not something that you can feel. That takes practice. You can feel how it got harder there. So you're gonna take your other arm, put it here, and she is going to try and push her arm down, and you're going to push that first rib down. Okay. So go ahead and do that. Right. Yep. Good. And you're gonna relax, and then you're gonna bring your arm up until you feel it get hard under her again. So probably right there.
Right there. Yeah.
Yep. We're gonna do that again. Good. And we're gonna do that one more time. It's always 3, so we always treat 3 times.
Right about there.
Okay. One more time. Good. And then we're gonna bring her back to neutral, and you're gonna refill, compare sides, and see if that feels better to you.
Yeah, it does.
Okay, let me see. It does. It's a little up still, and so I do some, uncross your legs for me. So I do something that's called HGLA. It's more of like a quick type approach to fixing it. So it's called high velocity volumetric fluid. So it's not something that this you probably could do, but generally HGLA is not something you guys do unless you're really trained in it. So you're gonna shrug your shoulder up for me, and I'm just kind of locating it, and you're gonna relax. And I literally just quick, shove it back down. And I don't tell the patients when I'm doing that. So that feels better. Oh, that feels good. Good. Perfect. Okay, you can stop recording that. I'm gonna show other things. So I've got a group of med students here with me. There's 4 of them here, and I'm showing them some things that they can learn and continue to do if they choose to. So what we're going to do now is something called a suboccipital release. Suboccipital release is something for people who have a lot of tension headaches. It can be for people who have neck pain. So what you want to do is you're going to find the suboccipital. So you're going to go to the base of the occiput, base of the skull, and you're just going to drop down to where it starts to feel soft. So this is the suboccipital area. So the easiest way to do it, I'm gonna have you bring your head off the table a little bit for me. And you can do it with both hands, but what you do is you push up in this way. And so, right here a little bit, okay. And you're just gonna relax. And so, when I'm feeling, I can feel that her suboccipital area is much tighter on her right than her left. And so I'm gonna put my hands there, and I can just do it one-sided, and I'm pushing up, and I'm pushing this way. Most of the time, this doesn't actually hurt people. This actually feels pretty good. And so you just relax, and what I do is I'm just continuing that, and I'll feel the muscles start to loosen, and I hold it a little bit past that. And then you can do it on both sides if you feel that it's tight on both sides, but this helps a lot of people with tension headaches. And so sometimes I'll even turn a little bit into it, but most of the time you can just do direct down, up towards you. So we can just do it like this. And you can even see if you're trying to figure out if somebody has tension headaches, like a lot of people come in for headaches in primary care. If you have someone with headaches, it's good to check their neck, like check their range of motion, and then feel at the suboccipital and see, like, and ask them, like, if I push here, does this reproduce your headache?
It does.
Yeah. Do you have tension headaches?
I don't have tension headaches. I would say, I don't know, it's like a combination.
Okay. Well, it's starting to loosen up. Did you kind of just feel how it got a little bit looser?
Yes.
So patients can feel what you're doing sometimes if you let them know, like, does that feel a little bit better to you? And they're like, yeah, I can feel that it's loosening up. It's subtle, but you can feel it. And so, like, that's what I'm feeling underneath my hands.
Yeah.
So I know that it's starting to loosen up. Good. See this side. It's a little bit tight on this side too. I like doing what's called a direct approach, where I kind of turn into what kind of hurts you a little bit. That's just, I just find that it works better for patients. Because you have indirect and you have direct approaches. Okay, scoot back on the table for me, and then we'll see if you have a first rib too, because I just showed them how to do a first rib. You can show it again. Oh, you have one too. Okay, so again, I've got the first rib right here. I'm gonna take the arm, pull it up. Actually, I'm gonna have one of you guys come over here so you can feel what I'm feeling when I treat. I can treat over you.